So, can you see my screen?
Yeah.
Good. So thank you, Sarah, for asking me to give you a short update about COSMIN. At first, I thought that I may not have that much to update you about, but when I started making the presentation, I thought, oh, well, maybe we do have some news. So, well, I'm sure you all know what COSMIN is, so I don't think I need to explain that, but we develop methodology and practical tools for the selection of outcome measurement instruments. And I'll show you a bit of our timeline, and I also will plug in some of our new projects. So we started with COSMIN in 2005, and our first project was to develop a taxonomy of measurement properties to define the most important quality aspects of patient-reported outcome measures. And we developed our first COSMIN checklist to assess the methodological quality of studies on measurement properties. And that was the PhD project of Wieneke Mocking, who you see on the right here on the top. And those are the other people from our initial steering committee. And we developed a COSMIN database of systematic review, of which I will give you an update later on. Also around 2010, I think already 10 years ago, Paula, we started collaborating on our first project. And we developed a guideline for the selection of outcome measurement instruments for core outcome sets. And in 2018, 3 new COSMIN papers were published in which we updated our methodology for systematic reviews of PROMs. We updated the original COSMIN checklist, which is now called a COSMIN risk of bias checklist. And we also developed a methodology for assessing the content validity of PROMs, because that was a bit, well, not paid too much attention to in our first checklist. Well, I'll give you an update about the COSMIN database in a minute. Oh, wait, I should see something, but I see us instead. Oh, yes, here it is. I will also tell you about the Corbel project, in which COMET and COSMIN participated since 2015. An important study that Wieneke performed was our VENI study. We'll explain what that is. We have recently published a COSMIN reporting guideline, and we are about to start a new COSMA-PRISMA study. So these will be the updates that I will discuss with you today. And the final one is our new course that we are developing. We're not doing all of that alone, so I plugged in some photos of people that we collaborate with, and you can see that there are many people from different countries all over the world, so that's very exciting and nice that we have those international collaborations. So first of all, our database, we systematically collect all systematic reviews of outcome measurement instruments that measure aspects of health status, so biological, physiological processes, symptoms, functioning, health-related quality of life. And we update these database yearly. And since a few years, the MAPI Research Trust is supporting us. They are actually paying the people who do the manual work updating the review, which is great because we didn't have funding to do this. And we also collaborate with the Zuid University of Applied Sciences in the Netherlands, who have a Dutch database of outcome measurement instruments. And we are now also linking the instruments that are included in the systematic reviews of our database to both the ProQualit database of MAPI and the Dutch database of the Zuid University. So if you are interested in a PROM, for example, the SF36, and you look it up in the ProQualit database or in the Dutch database, you will find a link to the systematic reviews in which that instrument was included. That's work in progress, so we're working on that. The links are not ready, or at least not all of them. because we currently have more than 1,200 reviews included in the COSMIN database, and it's quite a lot of work to extract all the individual measurement instruments from these reviews and link them to the other databases. But that's what we are working on. So this is a screenshot of the database. You can use search terms to find reviews of specific measurement instruments or specific topics of interest, like symptoms or physical functioning, and also age groups and study populations. And since recently, you can also search on the name of a measurement instrument to find all the reviews that include that instrument. And this is the ProQualit database that you may know. And for all of the instruments that are included in the ProQualit database where systematic reviews exist, there will be, at least in the future, there will be a link to those reviews. The CORBEL project is an interesting project. It is an initiative of 13 biological and medical research infrastructures. And the aim of this consortium, funded by the European Union, was to create a platform for harmonized user access to biological and medical technologies, biological samples, and data services. So it was very broad, mainly about infrastructure. And somehow, I even don't know exactly how that happened, but COMET and COSMIN were included in this project. We participated in a work package together with ACRIN in Paris and the German Mouse Clinic. And we looked at harmonizing of outcomes across animal and human research. And in the picture, you see me in the German Mouse Clinic, which was very interesting to see what they measure in mice and what kind of measurement instruments they are using. So with regards to COSMIN and COMET, also the output of this project was first of all a core outcome set for diabetes that COMET initiated and carried out. Nick Harmon was the lead of that project. And I am involved in 2 systematic reviews together with the German Mouse Clinic of measurement instruments used to measure well-being, quality of life, and fatigue in mice. And that's very interesting because so far I've only done systematic reviews of outcome measurement instruments used in human. But the discussion how to measure quality of life in mice and how those outcomes translate to human studies is also very interesting. The VENI study, VENI Vidi Vici, is a talent program of the Dutch Research Council, which offers individual grants to talented researchers. And our COSMIN lead, Wieneke Mocking, received such a grant for COSMIN. And the aim of that project was to generalize the COSMIN standards and criteria that were originally developed for PROMs to other outcome measurement instruments. And the main topic of that study was actually to develop methodological standards for complex reliability studies. And the issue with these studies is that they can contain multiple sources of variation. So, for example, patients can be assessed with different measurement instruments at different time points on multiple occasions, and the images or whatever is being measured can be rated by multiple raters. And you can imagine that you have all kinds of variations in a reliability study, and all those sources of variation leads to different research questions, different statistical models, and it is quite hard to assess the quality of those studies and the interpretation of the results. So that's what we did a Delphi study about, to develop methodological standards for these kind of studies. And that was recently published in the BMC Medical Research Methodology journal. We collaborated with the University of Michigan, who obtained a research grant from PCORI to develop a reporting guideline for studies on measurement properties. Such a guideline did not exist, and we set up a Delphi study with 48 individuals from 12 different countries, and we reached consensus on a set of 71 items, separated into a set of 35 common items that are relevant to all studies on measurement properties, and 41 were specific items that are relevant to one of the 9 measurement properties. So there is a general section in the reporting guideline, as well as 9 specific sections for each measurement property. So if you do a study on measurement properties, you can use this guideline to report, make sure that everything is transparent and reported. And this paper has recently been published in March in Quality of Life Research. The COSMA-PRISMA study is a study that is about to start. It is a collaboration with the Sickets Hospital in Toronto, Canada. We collaborate with that group already for a couple of years in other projects, and they obtained funding from the Canadian Institute of Health Research for the development of a reporting guideline for systematic reviews of outcome measurement instruments. And this new reporting guideline will be closely related to the PRISMA guideline. So that's why the study is called COSMIN-PRISMA study. And the study will start in August 1st, so next month. And the investigators are Martin Offringa, Nancy Butcher from Sickets, Wieneke Mokking and myself from Amsterdam. And the junior or postdoc researcher that is going to carry out the project is Ellen Elsman, and she's Dutch. She's currently working for us, but she intends to move to Canada when COVID restrictions allow that, to work on this project from Canada. Let's go. Yes, and then our systematic review of PROMs that was published in 2018 is often used, but we get a lot of comments from people that they find doing such a systematic review quite difficult. And we understand that, because actually a review of outcome measurement instruments is actually 9 reviews at once, because each measurement property requires different methods. And therefore you get different kind of results, different standards, different criteria. So what we now aim to do is to develop an online course for systematic reviews of PROMs. And that course will be a combination of self-study, online modules and exercises, as well as Zoom meetings with sort of meaty expert meetings. We're quite far now with developing the materials for this course, and we expect that in early 2022 we can start the first course. Well, not everything about COSMIN is always positive, and not everybody is always happy about COSMIN, so I thought it would also be appropriate to show you some of the COSMIN criticisms that we receive. Recently, 2 authors from the UK published this paper. Can we rely on the COSMIN checklists? Well, their answer was not always yes, obviously. And they had several criticisms. One of them was that they said reviews based on the COSMIN checklist procedure produce contradictory conclusions and fail to provide evidence to support the recommendations. They say there are many ways in which the COSMIN process can be easily frustrated. There's no guarantee that the reviewer will use the checklist as required. And the COSMIN standards required to evaluate the PROM are still vague and leaving reviewers to make subjective decisions. Well, we totally agree that the standards are well, I don't think they are particularly vague, but you definitely need to make subjective decisions. This is not a cookbook, and that's also impossible. So you always need subjective decisions. We wrote a reply to this paper, basically stating that we agree that it's sometimes subjective, and that we think that people need to be experts to do a systematic review. But it also makes us aware of the relevance of our course. Well, McKenna and his colleague replied again, and he also made another important point that I think I agree with this point. And they say that recommendations are based on dated methodologies rather than on looking to the future. And this explains why CTT, well, actually they say CTT, so the classical test theory is gradually being replaced by item response theory and rash measurement theory. And they basically say that these models are underrepresented, or standards for these methodologies are underrepresented in the COSMIN checklist. And I think that is true. We also experience that ourselves. If you have multiple IRT or RASH papers included in your systematic review, the standards and criteria are limited. So that is something that we could work on in the future. So I think that was all that I wanted to say about COSMIN. I hope you heard something new, and if you want to know more, this is our website and you can find all the information there.
Brilliant, Caroline. Gosh, wow, tons. Yeah, absolutely fantastic. So I've got